you put a lot of effort into maintaining those relationships with the patients that you've served, right? And obviously that helps with your word of mouth. So tell us a little bit about print marketing, right? You do a lot with print marketing. So what kind of things do you currently do with that?
So here this is one of our newsletters featuring Melissa.
Looks great.
So, and then a more recent one featuring our new building coming soon. So yeah, so we do newsletters to our past patient list every month. And what I've done in the last 6 months maybe is I got a warmer list together. So I took our last 5,000 addresses, which I think that's 2017, I believe it was.
Okay.
And so we decided to do that to our warmest list that we had. So the way we do it, and we've done it in various ways over the years, but right now what we're doing is we send it to 2,500 of our list each month. So every other month, a past patient is getting a newsletter.
That's awesome. So let's break that down a little bit, right? Because why would you send a newsletter? Why would you direct mail it to your patients?
Well, because we want to stay in contact with them. You know, these are what they call our low-hanging fruit. You know, these are people who know us, they like us, they trust us. So why wouldn't you want to stay in contact with those people? And in fact, I was just looking at some of our referral sources, and our return patients are 18% of our total referral sources.
Oh, that's
so
awesome.
With physicians being number one, but they're number two.
Yeah.
So it works, to stay in contact with your past patients.
Right. Absolutely. And so with your marketing there to past patients, you do both digital, like email, right? And then you also do direct mail.
Right. Yeah. And the newsletters, I mean, they go, even though we're direct mailing to half of our list, the digital goes to our entire 4,500 email list every month. So the ones that we're missing with direct mail, we're getting them on the digital side of that. And then the following month, it's just the opposite.
Yeah. So I think you're hitting two really important concepts here. One is, how do you leverage the customer list, right? Your customer list is the most powerful way of getting business, right, in your practice, especially if you've been established. So if you are effectively marketing to them, maintaining that relationship, then that's going to help you grow your business. The second part of that is, how are you marketing to those customers, right? And you have to, some people just focus, hey, I'm only going to send out something digitally, right? I'm only going to send an email to my patients because it's inexpensive, right, to send an email out. But I think you were telling me a little bit before, what's sort of the percentage of people that open emails?
So for our newsletter specifically, I think it was a 32% open rate, which is really high.
Yeah, that's really great.
I mean, according to Practice Promotions, my rep, Amanda, she says that's phenomenal.
Yeah.
That 32%.
Yeah, absolutely. So yeah, anywhere from the 30s to 40s is really good. But we're still missing 60 to 70% of the people that we're trying to communicate with, which is why when you do direct mail, you're actually getting into 95% of people's mailboxes. And one thing that's really important is the experience is very different too, right? When people pull something out of their mailbox and when they read something on a screen, it's a different cognitive experience for people. And we actually have a different response when we're holding something in our hands and reading and looking through it versus just reading it on a screen. Now in today's world, we want to have those multi-layer marketing where people are seeing it both on their phones and also in their mailbox, and that can have the maximum impact.
Right. And I would say, like, we constantly get patients just thanking us for sending out newsletters. And we get patients coming to us because of it as well. One example is a patient of mine that came to us for vertigo. They were referred by ENT for vertigo, but they live about an hour away. Well, they came into town for that treatment. Where they live, there is a PT clinic there, and she had a total knee and was going to PT, wasn't getting the results she wanted, and happened to get our newsletter, and so transferred her care to us and drove. But that newsletter reminded her, wow, I had a great experience. I didn't, she came to us for vertigo. And it just reminded her that we could treat her for her knee as well. So she came in and was super happy. And, that's somebody that we wouldn't have got probably coming back to us if they didn't get that newsletter.
Right, exactly. I think that's a great point there, Tony, because like as you and I are both clinicians, so I'm sure you've had the experience where, you're working with a patient maybe on their knee, and then someone who's getting treated for their back, and they're in the clinic, and they're like, oh, I didn't know you treated knees.
Right.
And you're like, yeah, we do. Right. And it's kind of the same thing with your newsletter, that someone might have come to you for their knee, and then you send them something on about back pain and how you can help back pain. And now they're like, oh, my husband has back problems and I had a good experience, at Kinetics PT. So let me come on back. Right.
Yep.
Right. And we're hoping to also do that very same thing with our diagnostic testing that we do, because, getting the word out about that, we're a one-stop shop. Don't drive all over town, to get your imaging, come to Kinetics. So right. I think that's great, gaining some traction.
Yeah. And you have a very unique selling proposition there, right? You're able to do the diagnostic testing, which is, pretty unique in the area, especially. And that's something you need to market and portray. Like, why would someone choose you? Well, you're doing musculoskeletal ultrasound, right? And also the EMG testing.
Yep. Yeah.
Yep.
Right.
Yeah, that's fantastic. It's a great promotion there.